Okay. Good afternoon to each and every one of you. My name is the Reverend Dr. Bobby Love, and I'm senior pastor of the Second Baptist Church in downtown Olathe, and also an organizer for More Squared Faith and Democracy, especially as we deal with issues concerning this Medicaid expansion. So I want to start out today with a reflection for us this afternoon to consider. And in this reflection, I want to challenge us because we're at the end of the year, the end of the 23 year, and we'll be embarking on a brand new year. And for this work that we are engaging in, I want to challenge us to really be concerned for our neighbors. And as you know, this particular issue is very near and dear to all of us in the faith community, all of you who took time to be a part of this webinar. And very briefly, what comes to my mind is, in my faith tradition, the story of the Good Samaritan. And that is found in Luke's Gospel. I think it's chapter 10. And when you read that, you see the story of an individual who is overcome by robbers and on his way on the what we call the Jericho Road. And I want to remind us that all of us are traveling our own Jericho roads, and that is the road of life. And as you and I travel the road of life, various things can happen. And in that story, we know that he was overcome. And in that, they left him for dead. And when we look at the state of Kansas, our neighbors, and I want to challenge us to be compassionate and be concerned about our neighbors. And that story embodies individuals who could have helped, but they walked by on the other side. And that story embodies someone who took the time to be compassionate, took the time to be concerning, took the time to care about their neighbor. And as you know, he took the injured person to the local inn, put him up, cared for his wounds and so forth, but he left a commitment to pay for the services. And I want to challenge us as we go through ending this year, beginning a new year. Let us continue to show compassion for our neighbors, those who are left out by the gap of not having access to health care. Let us show care because we can care for one another. We are our brothers and sisters' keeper. And then the commitment to put in the time, the commitment to share with others on this issue. So with that, I want to encourage us as we do our work, as we gather today, to remember those things, that we too can care, we too can be our brothers and sisters' keeper. So with that, I turn it back over to our host, and thank you for the opportunity to share with you briefly this afternoon. Thank you, April.
Thank you so much. I really appreciate that, Reverend Love. I think that it's really important anytime we talk about Medicaid expansion to make sure that we're all on the same page about what it is we are considering. So I'm just going to spend a few minutes hitting the highlights to make sure that everyone understands what that is. I'm going to turn on my slides, so show you a few slides. And then we're going to go through this a little bit quickly, but if you have questions, please feel free to put them in the chat of the webinar. Okay, so hopefully you are seeing my screen. if you are not, hopefully someone on our team will let me know. Basically, Medicaid expansion was created as part of the Affordable Care Act about 12 years ago. And the goal was to extend health access to affordable health care through health insurance to low-income Americans. So under this proposal that was first made in the Affordable Care Act, the government pays for 90% of the cost and the state pays for 10% of the cost of covering this new population of individuals. And in Kansas, it's expected that Medicaid expansion would provide 150,000 Kansans with access to affordable health care. Perfect. So I wanted you to see the map of states that have already moved forward with this. It actually, this part of the Affordable Care Act, along with many other parts, was challenged in the courts way back in 2010 and 2011. One of the challenges that stuck was that states could not be forced to participate in this expansion of their Medicaid programs. So instead, the Supreme Court said that each state would need to individually decide whether they wanted to be part of expansion. So to date, 40 states have already expanded. And in this map, all of the states in dark blue are the ones that have expanded, and the ones in orange are the ones that have not. You will notice that by and large, Kansas is now in a group of deep South states that have chosen not to move forward with this. And I think you will see that most recent state to expand was North Carolina. So we're even creeping down into those southern states with the expansion. I also would just point out that every state that shares a border with Kansas has already expanded their Medicaid eligibility. I think that this umbrella is helpful so that we can understand what the coverage gap is, because we talk a lot about the coverage gap, and that's the real problem that we're trying to address here. So if you think of what the continuum of assistance that was provided in the Affordable Care Act, it really is a good representation with this umbrella. The individuals at the lowest side of the income earning scale would be covered with Medicaid. And then individuals at the higher end of the earning scale would be covered with subsidized plans through the Affordable Care Marketplace at healthcare.gov. So in states that have expanded eligibility for their Medicaid programs, this is a complete umbrella. In Kansas and states that have not, we have a coverage gap. And the way that works is that in Kansas, we have a pretty scaled back Medicaid program. So the basic rule is that adults do not qualify for coverage under Medicaid unless they qualify for an exception. One of the exceptions is that if you are the parent of a child under the age of 19 who lives in your household, then you can qualify if you earn no more than 38% of the federal poverty line. So if you think of that, 100% of the federal poverty line, it is considered someone living in poverty. And then you scale that all the way down to 38%. It's a very, very low amount. And we don't really see a lot of people who are able to meet that and get their coverage. And then we go back to the default is that other individuals, regardless of how low their income is, if they're an adult living in Kansas, they don't qualify unless they meet that exception. So I told you one of them. Another one is if they have a disability as determined by the federal government. And another is if they are pregnant. So there are different criteria for all of those things, but the majority of adults, regardless of how little they make, do not qualify for Medicaid. On the other side of that umbrella, you have to earn at least 100% of the federal poverty level in order to qualify for those subsidies on the marketplace. So there have been pretty generous subsidies that have been available, even no premium plans after the pandemic. But if you don't earn at least 100% of the federal poverty level, then you're not going to qualify for those. So this just gives you a little bit more of an idea. So like, for example, an individual who is earning, like if there's an adult in a family with 2 children, because this is based on household income, that adult could earn no more than $9,447 per year before they already earn too much to qualify for Medicaid, but they would have to earn at least $24,860 a year in order to qualify for those marketplace subsidies. And this table gives you a little bit more of an idea of what those different levels would be at different household sizes. I will just point out that unfortunately, the way that this policy works is it penalizes larger families. So for parents who have more children in their household, it can become more difficult for that parent to get to qualify for help because they often get stuck in this coverage gap because 100% of the federal poverty level goes up based on the number of individuals in your household. The key reasons for expansion that we see are that it fixes the eligibility limits that are way too low. We already talked about that. It reduces healthcare costs for everyone. If you have insurance, then you don't incur then you don't have to share. Let me say that again. If everyone is covered, then we don't need to all pay for uncompensated care for people who are not able to pay their bills. It protects Kansans from medical debt. It supports a healthier workforce. It keeps Kansans economically competitive. It preserves and strengthens rural communities, and it ensures uniform access to affordable health care for all Kansans. So those are some of the basic reasons, but I think today we're really going to be talking more about the faith-based reasons and the moral reasons why expansion is so important. So I will stop sharing my screen and invite the next speaker, who is Sister Therese Bangert, to share her reasons for supporting expansion as a member of a community of faith.
Good afternoon, everyone, and thank you for being part of this ongoing discussion on why it is so important that Medicaid is expanded for our sisters and brothers. I am a sister at Charity of Leavenworth, and with other Catholic sisters throughout Kansas, the Catholic sisters wrote a letter last year to Governor Kelly, to the leadership of the legislature, and in asking them to expand Medicaid. And I just want to give you a few quotes from that. As persons who have dedicated ourselves to living the gospel, we believe it is deeply immoral for more than 150,000 Kansans to go without medical care. As Catholic women religious, we built the first private hospitals in Kansas. And I might add, we cared for people whether they had the money to pay or not. We have staffed schools, hospitals, and orphanages in Kansas for over a century. We recognize suffering. We recognize need when we see it. We ask that you trust us when we tell you that Kansans, through no fault of their own, are distressed and dying from unmet medical needs because they do not have reliable, affordable access to health care. The statement goes on, but another part acknowledges that Medicaid expansion is a matter of racial justice. In Kansas, those in communities of color are 3 times more likely than those in primarily white areas to lack any form of health insurance. As a state, we're morally obligated to reduce these disparities and to ensure that communities of color have equal access to health care. I was thinking that all of you who are gathered, hopefully you'll take on the title of causing good trouble. John Lewis's postage stamp is out, and we know how he made famous, I think, that statement that all of us should be about good trouble. And I think being about good trouble is part of what our effort to expand Medicaid is. My office is at a safety net clinic called Duchesne. And one of the services of Duchesne is that we have people who are entering the medical profession come in and be mentored and to learn. And I want to share with you a statements from one of those pharmacy students. So he was asked, what has been most rewarding for you? The most rewarding thing, Jason said, is the gratitude that the patients display for helping them. They are just so grateful that people are here to help. Then there was a question in his exit interview, how do you feel you have changed? The biggest change I've experienced, he said, is my perspective on the poor. Previously, I wasn't sure how I felt about free health care. Someone's got to pay for it. I was thinking they were ungrateful. Who are these people? Why aren't they working? Why should I pay for their health care when I'm breaking my back in student loans to support myself? Then he continues, it's so easy to judge people from the outside. Meeting them and hearing their stories completely changed my outlook. These are people trying very hard to get by, to meet their obligations, to put food on the table for their families. Then he was asked, what are the most pressing concerns that he saw? The first one he acknowledged was the risk when someone's released from the emergency room. And unless they know about the clinic, they really have no place to go. So what do? His second concern was how sick they are when they do make their way to the clinic. Some come in with conditions that could have been remedied, but instead, because of their delay, have worsened. And often these conditions have worsened to the point of irreversible damage. One man let his gout get so bad that his hands were deformed and his kidneys diseased. He's only about 52 and will probably not live past 60. And then he said, Jason continued, I think the reasons they wait so long are they can't afford medical care and don't always know about the clinics. They have transportation issues, and time off from their job may jeopardize their job, and it also means a lower paycheck, which they can't afford. I want to say that this young man learned all of this in 1 month. I think it underlines in our sister statement that we know that people are suffering. And as people of faith who believe that we are all brothers and sisters, we know that is those of us who have much and our needs are met have an obligation to help them. I just would like to end with Pope Francis. Pope Francis says over and over and over again how important it is that we are indeed our sister and brother's keeper, that we don't pass by on the other side of the road. And all of my work is informed by Catholic social teaching. And the bottom foundation of that teaching is the dignity of every person and how having health care is part of that dignity. Please raise your voices with us and pray for these legislators on their journey ahead on this issue and all the issues. Peace, and have peaceful holidays.
Thank you so much, Sister Therese. Our next speaker is Saaliha Khan. Thank you so much for being with us, Saaliha.
Thank you so much for the opportunity. Good afternoon, everyone, or as we Muslims say in Arabic, Assalamu alaikum. Greetings and blessings of peace be upon you all. My name is Saaliha Khan, and it is an honor to be here with you all. I am a Muslim American. I'm a Kansan, and I believe that the time for care expansion is now. I believe that it is our moral duty, and Medicaid expansion is long overdue. I lived in California and worked for an organization that helped roll out Medicaid expansion under when California expanded it, and hundreds of thousands of patients were impacted by it. And I met these patients of all ages, pediatric patients, patients with chronic conditions, and the incredible impact it made on their lives. And we're doing an injustice to our fellow brothers and sisters in Kansas by not allowing federal funding for Medicaid expansion to happen, by not blocking care expansion. Our faith traditions, including Islam, teach us to help alleviate suffering, not contribute to suffering, to help care for those who are the most vulnerable amongst us, and not the other way around. Healthcare is unaffordable, and by helping bridge that gap, we are providing access to healthcare, which should not be a privilege, it should be a right. And I would like to share a few verses from the Quran, which is like the Holy Bible for Muslims. One of the verses in the Quran talks about, it is in chapter 2, verse 177. It says that righteousness is not that you turn your faces toward east or west, but righteousness is to give of your wealth out of love for him to your kin and orphans and the needy and those who ask. And so as we remember to fight for Medicaid expansion, we have to remember that hundreds of thousands of Kansans are going to benefit from it. Over 150,000, nearly 175,000, mostly working Kansans. And a hadith from Prophet Muhammad that I'd like to share, peace be upon him, it says, whoever of you sees an evil, let him change it with his hand, and if he's not able to do so, then let him change it with his tongue, and if he's not able to do so, then with his heart. And that is the weakest form of faith. And so the importance is that if you see an injustice happening, then you have to act on it. And it is in all of our faith traditions universally to translate our faith into action by caring again for those who are the most vulnerable amongst us. And it is high time for Kansas to allow the federal funding to reach those Kansans throughout the state in rural towns and urban centers who could benefit from it. Imagine if you received news that you had a health condition that was life-threatening, and imagine the fear that you would already be feeling in those emotions that you'd be going through. And on top of that, imagine being able to not afford care, and how heartbreaking that would be, how debilitating that would be. That's what we're doing to our fellow brothers and sisters, and we need to change that. And we need to tell our legislators to choose people over politics. We're going to ultimately take care of our patients in the hospitals anyway, might as well be able to provide them access to healthcare, to be able to prevent emergencies, to be able to get care before it worsens. That's why care should be expanded, amongst many other reasons. It would bring millions of dollars in tax money back to the state. It'll help keep rural hospitals open. The moral imperative is long overdue. As a Muslim, as a person of faith, I strongly believe that. And as someone who has seen the impact of it and being able to contrast it from having lived in different states, it just breaks my heart that we're depriving our fellow brothers and sisters in Kansas this opportunity to have access to care. because healthcare and health contributes to one's livelihood, and we're denying them their livelihood. That must change. We must come together, act, urge our legislators to take action and expand CanCare now. And as you heard April talk about the importance of bridging that gap between 38% to 100% or 138% to 200%, that gap, bridging it is so important because so many people fall into that gap. If you think about the federal poverty level, it is so incredibly outdated. You saw the numbers that she was sharing. It's absolutely outdated. And so there are so many thousands of people that could benefit from it. And why are we blocking it? Why has Kansas been blocking it? For no reason but politics. It's important to prioritize health and livelihood of our fellow Kansans and advocate for this. We look forward to advocating for this in this upcoming legislative season. Thank you.
Thank you so much, Saaliha. I really appreciate that. Our next speaker is Leslie Mark. And while Leslie is joining, I am also going to share some slides that she would like to share with you.
That's great. Thank you so much, April. And hard to follow two strong messages. But I wanted to just give you a little bit of an idea of how Jewish communities have thought about this through centuries, millennia. Jewish thinking always finds bearing in Torah, the first 5 books of the Bible, key moral and ethical precepts for living a good life, just as Saaliha was just talking about. And the great scholars and rabbis would go to work on a subject, sometimes for decades or even centuries, and that's where the variety, the deviance even comes in, you know, the spice of life, which makes putting pedal to the metal rather, sometimes challenging. So one of these was Moses Maimonides. He came along, 11 centuries into the Common Era, and he, I won't read what I have on the slide, you can look at that, but he was a strong philosopher and scientist and physician who penned commentary still read and used to this day. For example, it is obligatory from Torah that the physician heal the sick. That's from Mishnah Nedarim 4:4. He also drafted something that was a guidepost for cities, guidelines for cities, 10 paramount communal services that a city would have to offer its residents if it was to be a city considered worthy enough for a great scholar to live in. And first of the 10 was healthcare. So I just wanted to start with that. We can go to the next slide. In Kansas, Jews first show up in the late 1830s, I believe, and the first Jewish organization that was built was just after the Civil War, and that was a burial society and end-of-life care when those receiving that care can't repay, obviously, in any way, and communal resources were put to that. And like Sister Therese talked about, there was also a definite lure to providing health services and other services for health care. It took until 1901 for the Jewish Family and Children's Services to be established. It came out of the United Jewish Charities, and they created the Alfred Benjamin Dispensary by 1919. That was operating in Kansas City. And there are others, if we go to the next slide, other agencies that came out of that. That's Alfred Benjamin Dispensary drawing up there in the upper left. But Menorah Hospital was a hospital created by 1931. And that was a place where Jews who couldn't be served in many hospitals of the established Kansas City area hospitals, this was true in Wichita as well, became the place where Jews and often Blacks and other new immigrants who are not always initially welcome to the communities could receive care. And we also see JFS, as I mentioned earlier, Jewish Family Services, and Vocational Services, JVS, which helps welcome refugees to our communities. And that is providing first and foremost mental health services, healthcare delivery, refugee support, which includes work and workplace guidance, food distribution, shelter assistance, and ongoing community education. And if we can go here, I wanted to point out that we have already, as Kansans, created wealth and sent back in our taxes to Washington over $6 billion and counting. And that money has been redistributed to the 40 other states that have expanded healthcare access for all of their citizens. And it's too much to have sent to and spent on our neighbors all around us, while having brought home none of it to take care of ourselves. So our friend Maimonides back in the 12th century would say, we must heal the sick. And I would add that begins with us. So that's the end of my few little slides. You wouldn't have to see me. I do sport the map of all the states around us who have seen the light. And in the oft repeated in common vernacular of Jewish faith tradition, the tikkun olam, or repairing the world, this is part of keeping the world whole enough that we're not constantly having to repair. But I loved Saaliha's also call to imagine and work on our imagineering, because we don't do that often, of what a future society should look like and can look like. And residents of Kansas have been quite vocal about this, and our leadership has not. And we see this in the legislature, and the governor is now pushing back, and it's up to all of us to come together and help illuminate in our various strengths what our weaknesses are and how we can combat that. And I'll stop because I'm over my 5 minutes. Thank you.
Thank you so much, Leslie. Our next speaker has a really interesting perspective, because he is not only a clergy member, but he is also a member of the Kansas House of Representatives. So I'd like to introduce Reverend Tobias Schlingensiepen.
Good morning, and thank you for inviting me to be present with you. Can you all hear me all right?
We can, yes.
Good. Okay, very good. Yes, so my name is Tobias Schlingensiepen. I am a pastor of First Congregational United Church of Christ in Topeka, Kansas, and also a representative of Kansas 55th House District, which runs from Washburn University, past the public library and our hospitals, all the way down to the river, and from the wealthy west side all the way to the poorer Central Park area on the east side. It is a very diverse and very good representation of the kind of disparities that exist in our society today. I often get asked what it's like to be a legislator while being a pastor, and vice versa. And I have to say, while I believe firmly in the separation of church and state, I do not believe in the separation of the gospel from the political realm or from the public realm. And so during this time of year, Christians have just finished celebrating what's called Christ the King Sunday and Advent. Then we enter into the new year with Advent. And Advent, we liturgically prepare for the return of the King, if you will, for the return of Christ. So I want to point just briefly to Matthew 25, to the story of the return of the King, which we all know so well. And it says, when the Son of Man returns in all his glory and all the angels with him, he will sit on his throne and will separate the goats from the sheep. The goats will go to the left and the sheep will go to the right. And the King will say to those on his right, come, you who are blessed by my Father, take your inheritance, the kingdom prepared for you since the creation of the world. For I was hungry, and you gave me something to eat. I was thirsty, and you gave me something to drink. I was a stranger, and you invited me in. I needed clothes, and you clothed me. I was sick, and you looked after me. I was in prison, and you came to visit me. And then what's really interesting in this particular text is that the righteous will say, well, when did we see you in all of this, in the ways you just described? And the king will say, in as much as you did it to the least of these, you did it unto me. And those who did none of these things ask the very same question. In other words, the wording is the same, but the import is quite different. And the import is, gosh, if we'd have known it was you, we would have done all these things. In other words, it's a kind of accusation. So while the righteous did what they did, not for any reward, but simply because it was the right thing to do, because they knew what was demanded of them, the others were only willing to do something if there was something in it for them. And so we get a very, very clear view in this passage, which really refers back to the Sermon on the Mount and is telling us kind of what the criterion is in the Christian tradition for how we are to be engaged. I'm often told that Medicaid expansion is a state program and has nothing to do with the kind of charity that Christians are invited to exercise, that government charity is something that's not demanded of us. It's individual charity that's demanded from us. And I have to say, one of the things that one learns rather crassly in the State House is that there's no paucity of Christian believers who sport their faith in all kinds of ways, while turning around and supporting policies, egregiously supporting policies that, without any explanation, that fly in the face of this most solemn criterion. And indeed, it is a very solemn criterion because it's one that is difficult even for the faithful to live up to. But at least one could state that one has problems voting for certain things, even if one feels that it's better than nothing. I, of course, have been involved in one way or another in Medicaid expansion from the very beginning, mostly pounding on the outside of the State House and visiting legislators with many of you to convince them to do the right thing here. But that has fallen, unfortunately, on too many deaf ears to affect what it is that we all hope is going to happen. I think as a pastor, what really disappoints me is that there is a disproportionate amount of prayer in the State House and then willingness to really understand what it is that they're called to pray for and act on. And so I've really seen my role in, at least with regard to my fellow Christian clergy, to remind them of what the scriptures that should compel us both, what it says, and why we should not be comfortable using the gospel to support the greedy and to further make difficult the lives of the needy. And but this, in fact, is what is happening, and it's a very cynical development and a very sad development. I know as a politician, on the other hand, that to quote Mick Jagger, you can't always get what you want, but you can often get something. So in this most recent push that the governor is making for Medicaid expansion, which, as you know, includes a work requirement, my gut, of course, wrestles with what that work requirement means and what it suggests about Medicaid or healthcare access being a right, as opposed to something that one has to somehow prove worthy of. I'm going to wait and see, of those 150,000 roughly Kansans that are have no coverage currently, what that would actually mean in real numbers. Politics is the art of the possible, as we've all heard many, many times, and one often has to do things as a politician that fall far short of the ideal. But for those who have, as Reverend Love put it, have fallen by the wayside, certainly we should attempt to help as many as we possibly can. But I still have a bit of a residual stomach ache in this regard, because at the end of the day, in the passage that I was speaking about, Christ stamps, if you will, God's identity onto the face, onto the lives of every human being, and upon those who lack what it takes just to live, primarily. and what is demanded of the rest of us is clear enough from that point of view. And while I don't think it's anyone's obligation to profess their faith in the State House, I do think that if they profess their faith, they should be held accountable for it. And so it's those kinds of discussions that I try to have with my colleagues. And I really want to sort of press home to my clergy friends, although those who are here probably don't need to hear this, but to those who maybe aren't here but should be, you need to do a better job not reaching out and ministering to the deep pockets in your congregation. You need to teach the gospel and go for broke and stand up for what is really demanded, because when the king returns, your deep-pocketed friends that you may be offending in your sermons are not the ones that are going to save you. But that said, it's not an easy task that we have ahead of us. As April pointed out so correctly, it's almost 12 years now that we've been trying to make the argument and have met with largely deaf ears. So it is my hope that we can do a better job teaching in our faith communities, and at the same time can rally enough power among the people across the state, and that's precisely where the faith communities, really can be of assistance here, because there are plenty of faith communities that have enlisted in the power grab, but not enough, I fear, who have enlisted in the cause of the powerless, and the powerless deserve a seat at the table, every bit as much as everyone else. And we need to make sure that that is possible and that happens, and that if we're going to betray our faith, we should at least say that we're doing that and why, and not just simply assume that God smiles upon our rather unevangelical political aspirations. So that's the situation I find myself in, and I appreciate being here with you this morning. Your work has been very inspiring over the years to me. Certainly, we need each other in this fight, because it is quite discouraging, and one really needs to have the long view. And we know that even when Medicaid is expanded, our nation still falls far short of what is necessary to provide the kind of care that people deserve. And deserve is the wrong word, the kind that by virtue of their very existence they should be entitled to. So with that, thank you very much, and thank you for the good work you do. I certainly need all of you to help me do and be what I hope I can be in the State House, and hopefully to comfort me when I get trampled underfoot. Thank you.
Thank you so much for your insights and for your support for expansion. We are very grateful. I'm going to pass things back to Reverend Love now to talk a little bit about the campaign that we have ahead for faith-based advocates, and maybe a little bit about the history of where this started last year. So I will invite Reverend Love to come back and share a little bit with us about those things.
All righty, thank you very much. I need the host to turn my video on.
Yes, there you go.
Here we go.
Okay.
All righty. Again, good to see everybody. A couple of things that I want to share as we got into this work. Want to share with you one of the campaigns that we did last legislative session. Our group put together a postcard campaign, and we collected about 1,000 postcards that indicated to our legislators, were they listening to what the Kansas were saying about. There's almost 78 to 80% that wanted this. So we delivered those the early part of the year to the Senate districts. Clergy and I went to Topeka and delivered those. Now, the upcoming things that are going on that we are looking at, and you might want to put these on your calendar. we're looking to do a Medicaid expansion vigil there at the State House. And that would occur on January the 30th. And then we're looking at doing a Medicaid expansion Sabbath. That would be on February the 4th, which is the a deal to get all of the churches and faith communities to be a part of that. And then on February the 14th, a campaign to say, love thy neighbor. And that would be a day at the State House as well. And as I'm speaking right now, there are some events that are going on in the Olathe, the Kansas City area. This past Wednesday, we had the Can Care bike ride. There were some bike riders who highlighted this issue here in Olathe. The St. Andrew's Church of the Disciples Christian Church and Second Baptist bike riders came, rode around the Johnson County Courthouse to bring issue with this. Today they're in Kansas City, Kansas, and then there will be another ride the end of this month with bicyclists riding in the Prairie Village area. So there's a lot of things that are going, and I simply want to close again as I started. Let us be continuous with our care, compassion, and concern for those of our Kansans who fall in this gap. And I simply will close with this. That same story, the person asked, who is more neighborly? And the answer was the one that showed mercy, or the one that showed compassion. The statement was simply, go and do likewise. So I want to encourage us as we look at these various activities that have been set aside. Let us find it in ourselves this Christmas. Let us find it in ourselves in whatever faith tradition that we're in, to go and do likewise. So with that, I yield back to Ms. Holman.
Thank you so much. I want to just let you know that we're going to be sending more information in a follow-up email to everyone who participated in the webinar, both about those upcoming events, and then we'll also include the slides. There has been a request to have those. We certainly want you to have all of the information. I know that there are some questions that are in the chat, and I don't know if I'm not very good at multitasking, and so I haven't been able to really dig into the answers, but we're going to save those and make sure that we respond to you all individually. And then at this point, I am going to turn things over to Rabbi Moti Rieber to just kind of provide closing comments, and we really appreciate the partnership of KIFA, as well as all of the groups that have been represented here today.
Thank you, April. Thanks, everybody. I'd like to thank all the faith leaders who joined the call today and gave us their wisdom and their guidance and their leadership. I want to say one thing about policy, and then I'll close. One of the focuses recently of the welfare reform conversation in Kansas has been about homelessness. There's kind of a bit of a moral panic a little bit about sort of the visible manifestations of homelessness in some of our urban areas. Of course, with this legislature, they tend to take a law enforcement perspective on everything. But I would say that, and I've said this in hearings and I'll say it again, the most significant homelessness policy that you could have in Kansas is Medicaid expansion, because it would address one of the things that really causes people to go into economic uncertainty, which is the cost of healthcare. Also, it would help our cities and our counties fund mental health which is something that people talk about but very rarely do anything about. But Medicaid expansion is not simply a policy to allow people to get access to the ACA. It's a way to address some of our pressing issues that don't necessarily directly look like they are impacted by healthcare, but definitely are. And I'll say again that I think the most significant housing policy that we could have in Kansas at this stage is Medicaid expansion. And that's another thing that we should be thinking about as we enter 2024. You've heard from many committed faith voices, people who have been in this work for a long time, have steadfastly advocated and prayed and witnessed for Medicaid expansion, and will continue to do so. I think the thing that you've heard that I really want to reinforce is that Medicaid expansion is a moral imperative. It's been a moral imperative for 10 years. It's a moral imperative today. It's the most significant moral thing that the legislature could do to address the needs of Kansas, is to expand Medicaid. Healthcare is a human right is another thing that we should be saying, and that we do say. There's no moral argument here, really. There's a political argument, but the moral argument is very clear, and that's why so many faith leaders from denominations and from different religions are so supportive of expanding Medicare. Of Medicaid. We're grateful to the governor for continuing to keep this on the agenda. If the governor was not working this as hard as she is, we probably wouldn't be talking about it as much as we are. And I think we're grateful for that. We ask for ourselves, we ask for the strength to see this work through to a successful conclusion. And we also pray for legislative leadership to find the wisdom and the compassion to do the right thing for 150,000 of our siblings in Kansas, and allow them to get access to the same kind of quality health care that many of us take for granted. We want to thank our panelists today, and we thank also the people who came on this call. It looks like there's 87 participants, or 78 attendees and 9 panelists. So that shows a lot of interest. There's obviously a lot of interest in this issue. And we look forward to joining with you in 2024 and bringing this issue to a successful conclusion. Thank you so much.
That concludes the webinar. Thank you for being a part of this. And we will be, I'm sure, working together and having more opportunities to, discuss what's coming next and how we all might work together to make this happen. So thank you very much. I appreciate your time today. Bye.